Assalamualaikum warahmatullahi wabarakatuh. Hello everyone, how are you today? Hope you always great and have a good day. First of all, I would like to say thank you for this opportunity to present my little research about cigarette smoking. Before that, let me introduce myself. I am Rila Nazila and there is my student ID. I am a student in Biology Department of Universitas Negeri Jakarta. Okay, without further ado, like I said before, on this occasion, I will explain to you guys about what is cigarettes, smoking, nicotine, what smoking causes, and etc. Okay, first we will talk about smoking and cigarette. According to CDC, cigarette smoking causes more than 480,000 deaths each year in the United States. This is nearly 1 in 5 deaths. Smoking causes more deaths each year than the following causes combined. More than 10 times as many US citizens have died prematurely from cigarette smoking than have died in all the wars fought by the United States. Smoking causes about 9 out of 10 of all lung cancer deaths. More women die from lung cancer each year than from breast cancer. Smoking causes about 18% of all deaths from chronic obstructive pulmonary disease or COPD. Cigarette smoking increases risk for death from all causes in men and women. The risk of dying from cigarette smoking has increased over the last 15 years in the US. We move to cigarettes itself. Cigarette smoking is the largest preventable risk factor for prevalence of cigarette smoking in the second half of the century. Daily smokers smoke cigarettes to maintain nicotine level in the brain, primarily to avoid the negative effects of nicotine withdrawal, but also to modulate mood. Regular smokers exhibit higher and lower levels of stress and arousal, respectively, than non-smokers, as well as higher impulsivity and neuroticism trait values. Nicotine dependence is the single most common psychiatric diagnosis in the United States, and substance abuse, major depression and anxiety disorder are the most prevalent psychiatric comorbid conditions associated with nicotine dependence. And we move to nicotine. Nicotine is a plant alkaloid found in the tobacco plant and addictive central nervous stimulant that causes either ganglionic stimulation in low doses or ganglionic blockage in high doses. Nicotine is a dangerous and highly addictive chemical. It can cause an increase in blood pressure, heart rate, flow of blood to the heart, and a narrowing of the arteries or vessels that carry blood. Nicotine may also contribute to the hardening of the arterial walls, which in turn may lead to a heart attack. This chemical can stay in your body for 6 to 8 hours, depending on how often you smoke. Also, as with most addictive substances, there are some side effects of withdrawal, and some e-cigarettes and newer tobacco products deliver even more nicotine than traditional cigarettes. Nicotine and smoking cigarettes not only affected the smokers, but also the second-hand smoker or passive smokers. Second-hand smoke and vapor is a serious health hazard for non-smokers, especially children. Non-smokers who have high blood pressure or high blood cholesterol have an even greater risk of developing heart disease when they are exposed to second-hand smoke. Second-hand tobacco smoke contributes to thousands of premature heart disease and lung cancer deaths. Most smoking-related deaths arise from cancer, mainly lung cancer, respiratory disease, or mainly chronic obstructive pulmonary disease (COPD), and cardiovascular disease, or mainly coronary heart disease. Smoking is an important risk factor for stroke, blindness, deafness, back pain, osteoporosis, and peripheral vascular disease. or leading to amputation. Smoking can also cause reduced fertility in both women and men. Besides, smoking also can affect the second-hand smoker or passive smoker. They have an even greater rate. Those non-smokers who are exposed to smoking environment have an increased risk of cancer, heart disease, and respiratory disease. A lot of bad effects were caused by cigarette smoking. Here I explain to you what are the benefits of stop smoking. Smokers who stop before their mid-30s have approximately the same life expectancy as never smoker. Stopping smoking has different effects on different smoking-related diseases. Stopping smoking returns the rate of decline in lung function to the normal age-related decline, but doesn't reverse this. It reduces the frequency of exacerbation or acute attacks of breathing difficulty resulting in death or hospitalization in, say, COPD patients. Stopping smoking freezes the risk of smoking-related cancer at the level experienced when stopping occurs but doesn't decrease it in absolute terms. Smokers who stop show reduced level of stress and mood disorder than those who continue. They also report higher levels of happiness and life satisfaction than those who continue. This suggests that smoking may harm mental health, though other explanation can be ruled out on the current evidence. Aside from the foregoing, quitting smoking has many other benefits, like reduced risk of heart disease and respiratory ailments, as well as reproductive disease problems. In addition, giving up cigarettes also saves those around us from danger of secondhand smoke, also save our environment from air pollution. We are at our last subtopic. What can we conclude from this topic is cigarette smoke and other smoke has been one of the leading causes of death. Many of the bad effects are caused by smoking, such as heart disease and lung cancer deaths. Also reduces fertility in humans. Not only the first-hand smoker, it also gives bad effect to second-hand smoker. The second-hand smoker have an even greater risk than the first-hand smoker. Because of that, it would be nice to quit smoking, for it benefits not only to ourselves, but also those around us and our environment. That's all from me. If there is any question, you can ask me in Q&A session. Thank you for your attention. See you next time. Goodbye. Wassalamualaikum warahmatullahi wabarakatuh.